So our audience is mainly parents with young children around aged 2 to 5 years.
Correct.
So why is dental hygiene so critical for children at that age?
So usually 2 to 5 years is very critical because that is the time the child starts, having their dietary, they start having their own regular routines for diet, and even brushing routine comes into the play. Some children develop some oral habits, cavities start forming because the junk gets introduced at that time. So that is the reason 2 to 5 is very critical.
They often say they only have baby teeth in that time, so it doesn't matter. How true is that?
So it is not true, sir. So why? Because milk teeth plays a very important role for the permanent teeth. So if at all the milk teeth, gets a cavity and sometimes they get infected, so the permanent teeth buds will be just forming below in the jaws. So around that age group, the permanent teeth would have been just a small calcified bud over there. So once these get infected, the milk teeth, the permanent teeth gets affected in some way. So that way, permanent teeth also, the milk teeth plays a role in developing the health of the permanent teeth, and also it helps in developing occlusion, good alignment of the permanent teeth. In some way or the other, it plays a very important role.
Thank you very much for clarifying that. Now let's talk about kids' basic oral care at home. When do you start brushing a child's teeth? At what age does it start?
So ideally, the brushing should start as soon as the first teeth erupt. And usually the first teeth erupts around the age of 6 to 8 months. So usually that is the time the first we introduce with a silicone finger brush for brushing. Even before that, I would suggest that, infants after being fed, always they can use a soft cotton cloth or wet gauze around the finger and, clean the gums. That way, that time itself, we are actually introducing oral hygiene, and oral hygiene once introduced, you can always maintain it and you can ensure a cavity free mouth.
But as a parent, I see that children resist brushing.
Correct.
So how do we as parents go about it? Like, how do we ensure the children are brushing their teeth effectively, especially at this age when they don't
Correct.
really follow anyone's instructions?
So usually, see, sometimes brushing also becomes like a punishment for the children. So that is the reason we should make sure that brushing is introduced as a daily play. So, parents can brush along with the child. They shouldn't feel that they are the only ones brushing. Maybe they can play some nice favorite songs or some kind of timers they can play. And if we allow the child to choose their own toothbrush, they will be more interested and fascinated. And, every 3 months we can change the toothbrush. So that also kinds of give them motivation to brush, and maybe we should reward them, keep some positive reinforcement for children, so that way it will they'll actually be building more confidence and more encouragement to brushing.
Got it.
Yeah.
Any fun strategies of how we could, maybe you spoke about it, like
Yes, yes.
any examples you can give us of
So
any fun ways
usually-
of how we make it fun for the
Yeah,
children?
you can play some, songs like that time, their favorite songs, or maybe some stories. So every day it forms a routine for them. Sometimes, for very small kids like toddlers, you can do in lap to lap brushing also. The child can be put on the mother and father and they can sit, and lap to lap they can brush. Or sometimes a little more grown up, we can brush from behind. And when parents also brush with the child, it becomes a routine. And slowly they will itself inculcate the habit anyway.
Sure, but we've also seen that, especially with brushing, children are excited of the toothpaste because usually they're sweet.
Yes.
So how much toothpaste is okay?
So actually, according to the latest guidelines, so there is a amount of toothpaste is very important. So for up to 2 years, we generally advise only rice grain, that is just smear over the bristles and use it. And above 2 years, 2 to 6 years, you can use a pea size amount of toothpaste. After that, you can use even the full length of the brush, it doesn't matter. And fluoride-based pastes are recommended now according to the latest guidelines.
Any particular brands that you certainly recommend for our parents to explore?
So any brands, sir, like 1000 ppm fluoride is recommended nowadays. So you can use something like, there are brands like Aquafresh Little or Pediflor 1000 ppm fluoride. These are all pediatric toothpaste with 1000 ppm. Otherwise, our regular toothpaste like Colgate, Pepsodent, all this also have 1000 ppm fluoride.
Okay, good
Yes,
to know
yes,
that.
yeah.
So, apart from just brushing your teeth, any other oral care you recommend for children, young toddlers, and little elder children?
Usually, see, brushing is most important. Flossing is also a good habit if they can inculcate dental flossing. But usually, the milk teeth always have spacing in between, so most of the time we don't require to floss it. But once it is mixed dentition, it is always better that they develop the habit of flossing also. And generally, we don't recommend mouth rinses, but so there are kids, parents who ask, if there is bad odor in the mouth, they would like to. That time, we do recommend some mouth rinse for children.